Welcome, everybody. My name is Deborah McElliott. I'm a nurse practitioner from the Center for Wellness and Integrative Medicine. My colleagues, Deb Demisa and Jen Caliendo, are here with me as well. And we'd like to just start by thanking the Nassau County Medical Society for partnering with us in this series. Tonight, I'm hoping to do a brief focus meditation, a breath focus one, and a heart focus meditation, and a little bit of an overview of why this is so important for us. We want to make this experiential, so tonight we'll do two quick types of meditations that hopefully there's something that you can incorporate into your daily life or practice. So this is our center located in Roslyn in the Harborview Shopping Center. Our mission is to live, practice, and teach integrative approaches to wellness and prevention using evidence-based healthcare. And the integrative approach, I like the definition that comes from Dr. Andrew Weil, where he talks about integrative medicine as healing-oriented, whole person, including the whole lifestyle, looking at relationships and appropriate therapies. And Wayne Jonas talks about integrative health as including conventional medicine, complementary and alternative integrative therapies, but a big, huge emphasis on self-care. So that's really the point of the talk today, to see how we can incorporate some integrative therapies, some mindfulness, some meditation into our self-care. And this little triangle, you know, the focus is really healing. And a large part of self-care starts with the self-reflection, includes self-assessment, looking at ourselves as a whole person, and partnerships, because pretty much nobody can do this by themselves. When we talk about a whole person assessment, again, it's you know, even more than the body, mind, spirit, looking at these different components of health and wellness. So again, just an overview of why we're looking to focus on some meditation. So I'd like to start with a brief breath awareness. So you don't have to look at the screen. I'm just going to ask you to sit comfortably in your chair, place your hands on your lap, take your shoulders up to your ears, around and back so that the chest is open, and sit straight but not stiff, allowing the head to sort of extend up to the sky so that the spine is stretched. And I ask you to bring your awareness to your breath and just notice it. Notice the inhale, notice the exhale, and notice the pause. And allow yourself to sink into the rhythm of your breath. You can take your hands and you can place them on the lower part of the abdomen and simply breathe into that area for about 5 breaths. Noticing your hands on that part of the body. Allowing the abdomen to rise as you inhale, and as you exhale, pull it to the spine to create that great abdominal breathing. And notice what it feels like to breathe in that fashion, bringing your awareness to that part of your body. Noticing the temperature of your hands on the body. And allowing yourself to sink into the support of the chair that you're sitting in. Then I invite you to take your hands and place them in the mid area under the breast. And allow yourself to breathe into that area. Again, noticing what it feels like to have the hands on that part of your body. Nothing forced. Just an awareness of the breath. And if distracting thoughts come to mind, acknowledge them without judgment and just let them go. Bringing the awareness back to your hands on the body and the breath. Then I invite you to take your hands and place them on the upper part of the chest. And notice what it feels like to breathe into that area. Feeling the chest rise and fall with the breath. You might even feel your heartbeat. and just notice. And then take your hands and place them wherever you feel the most comfortable. The body, the mid area, the abdomen. And if you were seeking to relax right now, that would be your sense of peace. That would be where you would start. So you can take a deeper inhale and a sigh as you exhale. And you can bring your awareness back to this room, to this time and place. And I ask you just to place in the chat where it felt the most comfortable. Did it feel the most comfortable breathing with the hands on the belly, in the mid area, or on the chest? And there's no right or wrong. And I'm going to ask Deb to just let me know what's in the chat as I change the slides.
Belly.
Yeah.
Lower abdomen. Chest. Lower abdomen again. Abdomen and lap. Lower abdomen.
Okay, so thanks, Deb. So there's no right or wrong. What I like about that practice is that usually one place in the body feels better than the other. So this is a great thing to do as a type of self-assessment. You know, for you right now, where does it feel the most comfortable to focus on the breath? And that's important because, you know, if you start to run, you're going to breathe faster. If you start to worry, you'll probably start to hyperventilate. So when you change the breath, it affects both the body and the mind. And that's where a lot of integrative therapies come into play. You know, the NCCIH has now recategorized therapies into different areas. So there's one area of natural products, then everything else is lumped into the mind-body practices. And the other practice are the traditional healing of Ayurveda, traditional Chinese medicine, homeopathy, and naturopathy. And this is old data from 2012, but we know that deep breathing, the yoga, the Qigong are definitely increasing in use in the United States. And we need these modalities, and we need to focus on our breath because of everything that you've been through this last year. This is just some of the things that are in the internet. You know, we need a national strategy to help health workers recover from the stress of the pandemic. We know that 1 in 4 essential workers were diagnosed with mental health disorders since the start of the pandemic. And 34% received treatment from a mental health professional. But we know that this stress has been even multiplied more if you're a healthcare practitioner that has a family that you're working with, that you're worried with, that you're trying to take care of. And one of the big things they're trying to focus on is this call to action to break the culture of silence. It's okay for us to seek help. It's okay for us to do self-care. The goal is to prevent this parallel pandemic where clinicians are all becoming ill. So we really need to, you know, we look at the numbers. We know there were issues with physician burnout and physician suicide before the pandemic. We know the cost was $4.6 billion a year. Now this is even more important. And one way to build up our resilience, and I know everyone says physicians are very resilient, and you are, but you know, we can lose those resilient stores if we don't take care of them. So mindfulness is a huge way to sort of bring that temperature and that stress level down, whether it's mindful movement, mindful eating, or mindful practices. So the mindfulness definition from John Kabat-Zinn, even though mindfulness is thousands of years old, his definition is the most popular. And it's an awareness that it rises through paying attention on purpose in the present moment without judgment. So it's knowing what's on our mind and accepting it. There's no wrong thoughts. What you decide to do with that is a different story. And the outcome is a greater ability to lower our reactivity. And also to notice sensations, to be more aware of how does it feel when we breathe in different parts of the body. And mindfulness is one form of many contemplative practices, whether it's knitting, crocheting, meditation, imagery, Tai Chi and yoga, prayer, music, many more practices that can help us heal body, mind, and spirit. So the meditation that we just did a breath awareness, which is a form of meditation. And again, that involves paying attention with an open attitude in a comfortable position with as few distractions as possible, which, is nice if you can be on a mountain or in nature in a beautiful spot. But we've done this, in the middle of hospitals, in the middle of units, in the middle of patient 4-bedded rooms, and people still have a great effect from it. So many different types of meditation. Over these 4 weeks, we're going to try to cover a couple of different ones. We just did a breath focus. Before we end tonight, I'm going to do a heart math-centered focus. We'll be practicing some yoga, some Tai Chi, which are also mindful movements and include their own types of meditation. And the benefits are huge physically. We know whenever you can induce relaxation, all the benefits that are attributed to that, from decrease in the sympathetic nervous system to increased immunity, helping the amygdala decrease aggression, decrease anxiety and depression. So I don't think I need to read the benefits of this to you, but just that it's time for us to really start taking care of ourselves. Guided imagery, very similar and includes some meditative techniques, is a process that works with the power of the imagination to positively affect the mental attitude and potentiate positive outcomes. So why do we want this? Why do we want this focus? It improves our concentration. It helps us respond instead of react, to be stable amid chaos, cope with stress, and think clearly. So I love these quotes. We don't learn from experience, we learn from reflecting on experience. And self-reflection is only useful when it's followed by thoughtful action. So over the next couple of weeks, I'm hoping that just by introducing these short meditations tonight, you'll be able to take them and start doing it and build on it, and see what kind of effect it has on you. And meditation is part of many different programs we have for physicians, whether it's a Heal Art program for med students, a Meaning in Medicine program. We have narrative writing, which is a reflective type of writing. So there's many different skills that you can put in your self-care toolbox. At the Center for people that want a deeper dive, there's a number of trainings in integrative therapies. We have a one-day program just focused on imagery, and we'll be working with the health system to do an adaptation of the MBSR 8-week program. That's a wonderful program. You can do it online through many different companies, but it does require 45 minutes a day of meditation, and many people just can't commit to that. So we'll be creating shorter programs that people really can start using this. So on May 16th, we'll be doing yoga and a loving kindness meditation. On May 19th, we'll be doing Tai Chi Easy, which includes some breath awareness, some meditation, and some self-massage. Then the 27th will be yoga and a different type of meditation with progressive relaxation and the focus on letting go. So I'd like to take the next 5 minutes to do this heart focus meditation, which is yet another one that you can certainly incorporate into your self-care plan. So again, I invite you to get comfortable in your seat. Let the body sit up erect. Feel the feet on the floor. Feel the 4 corners of the feet. And again, bring your awareness to your breath, noticing the inhale, the exhale, and the pause. Nothing forced, just an awareness of inhaling through the nose and exhaling through the nose. And again, if distracting thoughts come to mind, acknowledge them without judgment and just let them go, bringing your awareness back to your breath. And now I invite you to take your hand and place it over your heart. And imagine that you're breathing in and out through the heart center. You might even feel your heartbeat again under your hand. But bring your awareness to that part of your body. And as you do, I invite you to feel the feeling of love or gratitude for someone or something in your life. Don't think it, but feel it. Feel that feeling of love or gratitude for a person, pet, nature, greater being. And as you harness that feeling, allow your heart to pump that feeling to every cell in your body. And notice how that feels. And then take that feeling of love or gratitude and send that to everybody on this call. Everyone focusing on their own self-care in the middle of their busy lives. And then send that feeling of love or gratitude out to your family and friends, your coworkers and your patients. Send it out to the community. And send it out to the world. And know that this is something that you can do anytime you choose by focusing on the breath. Imagine that you're breathing in and out through your heart center and harnessing that feeling of love or gratitude for someone or something in your life. Sending it to yourself and sending it out to others. You can take a deeper inhale and a sigh as you exhale. You can take your hand and place it in your lap, and you can bring your awareness back to this room. So we're inviting you on this journey to taking some time for yourself and see if you can practice these brief meditations if they appeal to you. 1 minute meditation that I'd like to share with you. Let's see if this will work.
That you want to meditate, but don't have time. Maybe you've tried to meditate, but had some trouble. Maybe you had a wonderful experience meditating over there, but just can't find that same feeling over here. Well, my name is Marty Borison, and in this video, I'm going to introduce you to the technique of 1 moment meditation. Then you can meditate whenever you need to. Like when you're feeling stressed. Or feeling angry. Maybe you're having trouble sleeping. Or you're feeling anxious. Or you just need a new idea. Although 1 moment meditation is ultimately about meditating in a moment, we're going to start with a minute. We start with a minute because a moment goes by so quickly that it's very hard to notice. But a minute is like a moment with handles on it. You know where it begins and where it ends, so it's easier to grasp. If you're ready, we'll do the basic minute now. You might want to shut the door, or at least tell people you're not available for the next minute. You don't have to tie yourself in knots for this. Just sit with your legs planted firmly on the floor. Try to sit up straight, but don't be rigid. It's as if your head were being lifted up away from the weight of the world. Think of it as cosmic traction. Now put your hands in any position that's balanced, symmetrical, and still. Like this, or like this. During the minute, simply focus on your breathing, moment by moment. Of course, even in the space of a minute, you will get distracted. That's perfectly normal. It doesn't mean you're doing it wrong. But as soon as you notice that you're distracted, just think, and bring your mind back to your breathing. I'll ring a bell so you know when to start and when to finish. Ready? Then close your eyes. Oh, one more thing. It's okay to smile. And go. As you open your eyes, notice how you feel right now. Maybe a little bit refreshed, a little bit more awake, a little bit more open-minded. Not bad for a minute. And the more you do it, the better it gets. But please don't ever do the basic minute for longer than a minute. Don't be macho about it. Because the point of the basic minute is to show you that you can make a meaningful change in your state of mind quickly. For longer, you're cheating. With 1 moment meditation, you can also learn how to do the portable minute, which is very useful when you're standing in line, on a train, or stuck in a boring meeting. You can also learn the bonus minute, the surprise minute, and the emergency minute. With 1 moment meditation, you can also learn how to reduce the length of the basic minute step by step until it only takes a moment. And when you can...
Okay, so I just wanted to share that because I think for many people that say they can't meditate, a moment, a minute, how can you start and where can you start so slowly? So thank you, everybody. Have a good night and we'll see you next week.